And look right straight ahead.
American altruism at its finest.
It's a great feeling of accomplishment.
This is on its own the first free medical clinic in this city. Coughing?
Yes.
Listen to your chest.
9-year-old Patrick Corrigan has a lingering cough and chest cold. His mom, Betty, has no insurance and no money to see a doctor. But thanks to Chesapeake Care, she doesn't have to worry.
It means comfort and peace of mind that my son has the medicine that he needs, and he's looked at by a professional, and help is there. Absolutely. So he can rest comfortably at night.
It all started with this man, Dr. Juan Montero.
I saw more and more people falling between cracks, not being able to afford health care because of no insurance. Then I thought that something more should be done in the local setting.
Okay, so in other words, there was nothing pre-existing, it just appeared suddenly. Does it cause you any discomfort as far as pain?
That's when members of the local community got together and started to dream about a place that would care unconditionally.
Manned by physicians, giving their own time, their own efforts, at no expense to the community, and serve those people that were not being served currently by some existing program. And from that, sprung up Chesapeake Care.
But then came the problem of when to begin. Chesapeake Care board members began planning at the end of August 1992.
And I told him then that we will open October 1st. And of course, everybody just smiled at me. I mean, they never believed really that we could open October 1st. A beautiful fall day. October 1st, huh?
Opening ceremonies in record time, and a building donated by Dr. Stanley Jennings.
To see something develop in 2 months and an operation, and see patients coming in and finding that they should have probably seen a doctor before this but couldn't afford to me, that's what's outstanding.
Our very first, of course, fundraiser was a golf fundraiser. And very fearfully, we all went into this golf tournament.
But there was no need for fear. In June, more than 175 golfers and 30 local and national celebrities gathered at Cypress Point Country Club in Virginia Beach to raise money for the center.
I'm one of those that feel like athletes should give back to the community as much as possible, and it's always great when you can come back home and give back to the community and help out in any way you can.
Cut it a little bit.
It's free for people that can't pay, and they've handled over 3,000 people. I guess they had over 13 major surgeries since the opening of the clinic till February, so I mean that says a lot right there.
Any problems now with shortness of breath?
The momentum continued to build with more than 100 volunteer physicians, nurses, technicians, and lay people running the clinic 4 times a week after business hours. Approximately 25 people are seen each day.
And look right straight ahead. I just happen to be the doctor. I could be sitting right where she was if I didn't have insurance and I wasn't a doctor.
Whether they need a family practitioner or a specialist like podiatrist Dr. Scott Woodall.
It feels like there's still something rubbing in there, correct? Well, I think we all are kind of indebted to the community. I think there's something that we all need to give back.
Well, you have a segment of society that's supported by public funding, and then you have the other segment that can fend for themselves. They have insurance policies that will take care of their medical needs. But then there's this segment that have nowhere to go. And I think they need services too. We should not forget them.
The business community certainly hasn't forgotten them. The Chesapeake Restaurant Association sends food to the volunteers.
Chesapeake General as a whole, they donate their services as far as like the surgeries and the lab work. They've designated a certain amount of money.
Tracy Clymer works in Chesapeake General's printing department. He met Dr. Montero in the hospital cafeteria.
And first thing I asked him, I said, look, if there's anything I can do with you as far as printing, anything that, you know, we can do, just let me know.
And of course, the medicine. Pharmacist Mickey Stredler is one of many donating what you see here.
Being the fact that they can't afford insurance, most cases they can't afford the medicine either. And if you start talking about drugs like Cipro that are $50 and $60 for 20 pills, it really serves a big hardship for these people. So this place really can be a blessing in disguise.
A blessing for people like Henry Wynn, who needed a hernia operation and got it. A blessing for Nancy Carter, who needed a gallbladder operation to save her life and got it.
It is like a miracle. No, I don't think I could imagine, you know, that someone as myself, just sort of down on your luck, can walk in and say, you know, I've got all these things going on and I don't know what to do, and someone says it's going to be okay.
Little 9-year-old Patrick does know what to say to the Chesapeake Care board members.
Well, I tell them thank you.
As long as I'm healthy, I'll try to do the best I can to help other people, because that's what I was trained and sworn to do.
And through your support, Chesapeake Care will continue to care unconditionally.